Welcome to the Dixie and Dr. Krishan podcast. My name is Dixie Crawford, and we are joining you today from Gadigal and Ngunnawal country on this beautiful land that we call Australia. I'm Dixie. I am your host for this podcast, and we are going to be talking a lot about healthcare. So, for those of you who don't know me, I am an Aboriginal engagement consultant, and I have been working around Pfizer for a couple of years now on their Reconciliation Action Plan. I have a very strong background in healthcare and I work with a lot of organisations around RAPS. There's really good synergy between myself and the work that Pfizer does. And what we wanted to do at Pfizer was have a conversation about some of the common health conditions that are experienced in our communities and also have a bit of a yarn about the C word, COVID, and look at our medications in terms of what people there are some questions that people have around medications and boosters, vaccines, antivirals, all of these type of things that I know community conversations people in community are having. And I wanted to have a yarn with Dr. Krishan about this. So before we dive into that, all the content that we probably need to have a bit of a yarn about, let's get to know Dr. Krishan. So hello, Dr. Krishan. Nice to meet you. And let me, over to you to introduce yourself to people.
Yeah, hi Dixie. It's my absolute pleasure to speak with you today and your listeners. So, yeah, a little bit about myself and I suppose how I came to be a doctor working at Pfizer. A little bit about my background first. So I'm Sri Lankan by background, and my family moved to Australia when I was about 4 or 5 years old, and I grew up in Darwin for a short period of time. And then, but most of my childhood was spent in Newcastle. So Newcastle's back then it was a large regional town, country town. People from Sydney described it as. It's a bit of a bigger city now. But when I was at school, I vividly remember my dad. So my dad was a physician, and he used to occasionally around the dinner table, tell some stories, some anonymous stories, obviously, about some of the things he'd done that day, and some of the people and the patients who he'd seen, and the improvements that he'd been able to make to their health. And I certainly could see that it was very rewarding for him. And so that was obviously one of the major influences when I was deciding what I'd like to do when I grew up. And I was very fortunate to be able to be accepted into medical school, and it went from there. So after I finished university, I wasn't quite sure exactly what I wanted to do. I worked in a series of hospitals in Sydney mostly, in Western Sydney as well, including some hospitals in outer Western Sydney that had significant Aboriginal populations. And I did enjoy, I suppose, that aspect of community medicine. So not just working in hospitals, and that kind of led me into general practice or primary health care. And I was really fortunate to move around New South Wales a little bit. So worked up on the far north coast, worked near the Queensland border, worked on the mid-north coast as well, and then eventually came back to Sydney. I was enjoying what I was doing, working out in the community medicine, but looking to see, I suppose, how I could impact health beyond just the patient that was in front of me. And I did a few things. I worked in a health education area, communications area, and I was able to educate and influence health workers to make sure that they were up to date with the latest science and the latest healthcare information, so that they could get better health outcomes for their patients. Did that for a few years, still working in general practice, and then an opportunity to work at Pfizer came up, and that's where I am. I've been at Pfizer for quite a while now. Worked in a number of different scientific and medical roles, and more recently, I've headed up some of our initiatives around COVID, but also more broadly. It's a very big company. We have medicines and vaccines for a wide range of health conditions.
Right. So you've got a lot of background, a lot of experience, big background, a lot of experience in many different areas, which I love, right? Because diversity in experience means that you have the capacity to be able to reflect and understand and connect with a lot of different people with different lived experiences,
Uh,
right?
Absolutely. And, the work that I've done in hospitals and in the community health setting has really been invaluable to the job that I've been able to do at Pfizer. And, to be honest, when I am at work, I still consider myself, a doctor first and a Pfizer colleague second. And I try to bring that healthcare perspective to what we do at Pfizer, and that's really useful in us making better decisions at Pfizer as to where we prioritize our work, what kind of educational, informational work that we do. So bringing that healthcare perspective has been really useful.
It is a really useful point in terms of being able to understand what people's experiences are and how we provide person centered care, but also how we consider people in the design and the delivery of healthcare, which I think is sometimes the difference between healthcare being accessible to people and people not just having access to care. One of the points that you raised, which I think is really important, I just want to explore that if that's okay with you, is that you mentioned that you have experienced in hospital medicine or healthcare as well as community health. Can you talk to me a little bit about what some of the fundamental differences are between hospital care and community care, and how important community health care is important to the prevention of health conditions for any patient, but also particularly for Aboriginal patients?
Yeah, that's a really good point. And kind of look at it in two ways. So, hospital care is usually what I'd call treatment. So, something's generally gone wrong. You're experiencing an adverse health condition and you need treatment now. Now, it can be a little bit overwhelming and it can be a little bit impersonal, a little bit anonymized because the priority there is there's someone who's sick or very sick at the moment if they need hospitalization, and how do we get them better as quickly as possible. But ideally, we don't want people in hospital, and that's where prevention comes in, and that's where community health care, whether that's through medical clinics, whether that's through Aboriginal medical service clinics, that's really vital because that's where prevention. Now, a lot of treatment happens in the community as well, but prevention is really important. And we know that Aboriginal people, unfortunately, are a vulnerable group when it comes to conditions such as, heart conditions, lung conditions, infectious diseases, diabetes. And for many of those chronic kidney disease as well, for many of those chronic conditions, they can be prevented or they can be largely controlled with good community healthcare. What I call is proactive healthcare. So not waiting for something to go wrong before you go and see a health worker, but actually taking charge of your own health, knowing what to look out for, and having a really close relationship with your health service so that they know you well and you know them well, and what services are available that may be beneficial for you.
That's a really interesting point that you talk about in terms of proactive health. And I think in order for someone to be proactive and to be responsible or to early identify some of the challenges that they might be having with symptoms in terms of conditions, is to be able to have a relationship with either their local healthcare provider, the organisation, or the AMS more broadly, but also a clinician. So how does a patient from your perspective, or how does a clinician build a healthy and happy and engaged relationship with their patients?
So
Do you have
this
any advice on that?
Yeah, this is probably the most important point in making sure that people are healthy and well, and that is that health worker patient relationship. And what I'd say is, uh, often people when they go to the doctor that they just want to tell them, I've got this symptom here, it hurts here, or my breathing's difficult, or whatever. And that's sort of treating, an organ. And doctors don't like to just treat an organ. They want to know the whole patient and really the whole person. So, what's going on in your life? What's your home situation? Are you caring for somebody? Are you working? Do you have children? So it's really important to know, what's your whole situation? What's your whole family set up? And the reason that that's important is because that helps a doctor determine what your priorities are. And if you're just trying to treat one organ, or this shortness of breath, why is that important? Is it because it means you can't care for your family at home? Does it mean that you can't go to work, or what's the impact of what you're experiencing? Because that will often influence, some of the tests that are ordered. Can you get to this center that's, potentially in another city, to get that scan that you need? We need you to see this specialist. Are you able to get there? Or, how will that healthcare influence you? And also some treatments, it's really dependent on whether you're able to take it. Are you able to inject yourself, or is an oral treatment better for you? So the more people know, the more your healthcare worker knows about your whole life and your whole situation, the better prevention or treatment they're able to recommend for you. From a patient's perspective, I think what doctors are looking for is just be willing to be open and to share all about your life. It's a really safe space. It's a confidential discussion, and what we're wanting is patients to actually be fully open and to share everything that's going on, because often there's a little bit of information that you may think is not relevant, but it may be the clincher to determine what's the diagnosis and what's the best treatment for you. I wonder if I could ask you a question, Dix. When you're a patient, what do you look for when you go and see a health worker?
I look for a big smile, if I'm to be honest. I mean, I've been in many clinics and seen, multiple GPs over my years. I'm not going to tell you how old I am, but I've been seeing doctors for a very long time. Um, but I like a big warm smile and someone that makes me feel comfortable and to be safe in that space. And sometimes you can interpret, I get that doctors are busy and you probably see 25 patients a day. I understand that. But sometimes those little efforts around just the kindness can be the difference between breaking down a barrier, because sometimes I personally feel nervous sometimes when I go in to see a doctor and I'm not sure how things are going to go, and I'm a very confident person, right, just in general. So for me, a big warm smile, a hello, how are you, what have you been up to? What is, that rapport building stuff, that relationship building. So I'm seen as a patient and as a person versus just being another number. But one of the things that I often get anxious about is that I am worried that what I'm coming to see my doctor about is something completely wild that they've never seen before or they've never heard of, and they're going to think I'm weird or I'm different. Like in terms of, you've heard it all, right? Doctors have heard it all. There's nothing brand new that any patient is coming to you with that is completely out of this world, right? Like I'm looking for a bit of reassurance there, Krishan.
Yeah, no, look, it's very, very true. There is nothing that you're going to say or nothing that you're going to show that your health worker hasn't already seen or heard before. So I think, and you mentioned the word rapport. I think it's really critical that doctors, build that rapport first, and that don't just jump into exactly what's the problem now and what's the treatment for it. So I think if the healthcare worker can take the time, and I know it's difficult, everybody's rushed these days, and often, they don't smile, but hopefully most health workers do make the time to make you feel comfortable and build that rapport so that you can feel safe to communicate effectively whatever crazy symptom or idea or pain or whatever you're experiencing. And some health conditions can potentially, people feel a bit embarrassed and they don't want to reveal all at that first discussion. So it can be a series of discussions. It's important to have that longer term relationship, ideally with the same health worker, but I know sometimes that isn't always possible, but preferably with the same health service or AMS as well. But I can reassure you, as a patient, and look, I'm a patient too, and when I go to see a doctor, especially, if it's a specialist or someone who's, really, renowned or esteemed, you do feel nervous, and that's entirely normal. But I think the way to look at it is a doctor or a health worker is just another human being, just like you. They've just been trained in a different thing to what you have been trained in. So they have a little bit of expertise that you don't have, but it's just another person, and you should feel entirely comfortable to share everything with them.
Well, I don't want you to have a little bit of expertise. I want you to have a lot of expertise, pretty please, because if you have a little bit of expertise, then I'm actually going to be super concerned about what's
Yeah.
going to happen here.
Okay, I was maybe minimizing. They have a lot of it, lot of
Good,
expertise, but
because I'm trusting you with my life out here.
you are. They have a lot of expertise, but they are just people, and it's that communication, that rapport is absolutely critical, because if you're comfortable as a patient with them, you'll share more about your condition, but about your family, about your lives as well. And then that doctor can make better recommendations for you, more individualized, personalized recommendations for you. And these days we talk about what's called patient-centered medicine. So in the olden days, really it was doctor knows best, and doctor told you what you were going to do, and you really didn't have much input into it. But I've really observed this over my career, and probably, started when I was in medical school, that the doctor brings that expert specialized knowledge, but the doctor doesn't necessarily make the decision for you. So you have that discussion. And, for most conditions, there's usually, a couple of different options. And it's really important to know what a patient's perspective is and what their preferences are, so that you can come to a joint decision about what might be the best option.
That's actually a really important point. Around that shared decision making and you doing what is in your best interest, and that these are recommendations essentially, right? These are recommendations based upon the information you've given me and my knowledge and my awareness and my experience as a clinician about, this is what might be in your best interest to do from a treatment point of view and, diagnosis. But how do we empower people to have, I guess, autonomy and to make decisions about their healthcare when, you know, they can be pretty quiet in an appointment or they're a little bit shy. How do we bring that? How would a clinician bring that out in someone to be confident and comfortable to make an informed decision about their healthcare?
So it probably starts before you're in the consultation room. And I think education, awareness, we use this term health literacy, and that's really what's critical. So it's about a person having access to information, unbiased, trusted, expert information that is explained not in medical jargon or scientific jargon, but that is explained in language that all of us can understand, so that even when you go into the consultation room or when you come out of the consultation room, you've got another information source that you can read, digest, and understand over a longer period of time. Because often what's discussed in the room with the doctor, a lot of that is forgotten as soon as you walk out, because there's often a lot of information being exchanged, and it's very easy to forget as soon as you leave the room. So it's really important that really across our lifetime, not just when we're sick, but across our lifetime, people have access to easy to understand, trusted information about health and wellness. And, we're using the term wellness now as well. So it's not just when you're sick, it's not just when you need a diagnosis, you need treatment, but really about wellness and being proactive about your health, and preventive medicine, which could be, things like how do you stop smoking, how do you maintain a healthy weight, physical activity? How do you look after your psychological health and well-being? So it's really important that across, our lives, really, that we are tuned in. We do pay attention to what's going on in terms of health information, and so that when we do actually go and talk to a health worker or a doctor, we have a little bit of background information. And I should say, when I talk about trusted, reputable information, a little bit of a disclaimer. Social media is often, or internet searches is often not the best place to get that information. So, ask your health service or health workers, where do I get information that I can trust, that I can read up more about this?
So avoid Dr. Google and focus on your local healthcare providers.
Absolutely. And they can give you information. It may be booklets, it may be pamphlets, or maybe they will point you to particular websites or that they recommend as well.
I will just say I am guilty of searching and working out that I have these
Yeah.
really wild conditions from a headache. It's very random. Anyway, Dr.
Yeah.
Google is great sometimes if you're bored, but not to take
Not
medical
to, yeah.
advice from, right?
I can say about Dr. Google, it's the algorithms are pretty good for search engines now. And if you
I know.
search the right
You should see, I know. You should see the regular shopping that comes
that
to my
comes
house.
up, yeah,
Krishan.
I know. So Google, if you ask the right questions, it's actually not too bad. The problem is, and it can scare you, because often what gets highlighted is the worst case scenario. And look, if you've got a headache, it's probably not brain cancer, right? It's probably what we call a tension headache from stress, or things like that, or maybe it's a migraine, maybe it's something serious. The problem is when you do Google searches, they list everything, right? And you go to the first article, and your mind focuses on the cancer. You don't realize that that's probably in 0.01% of cases, and 99% of cases it's not serious. So that's why you actually need some more balanced pieces of information, and you need a health worker or a health service as well to interpret that for you.
Yes, so have a bit more of a balanced approach to that conversation rather than already planning your funeral songs, right?
Yes. So, look, we all do
Which
it.
is what I tend to do.
I do it as well. You get some symptoms, and being a doctor as well, you think, oh, it could be this. It's almost always not, but it's a human condition. We tend to emphasize the worst.
So is dramatic a human condition? Noted. I have a clear diagnosis of being
So
dramatic then.
you've got an
Okay,
excuse, Dixie.
so I think for episode 1, I think we're going to wrap up there because we've had a good yarn, and I guess it's really important for us to have an understanding about who you are, some of your experiences that you've got, and I've really liked that conversation about the importance of building a relationship with your clinician as a patient, but also the importance of a clinician to be focused on really building a relationship with your patient. So it's a two-way street rather than the one-way kind of process of just coming in, having the transactional appointment, getting sharing your symptoms and getting a medication and leaving, because healthcare is far more important than that. And as you've just said, wellness is something that is far more critical for our well-being as human beings in our communities.
Yeah, no, thanks for the opportunity. I'm really looking forward to exploring some of these issues in some of our future episodes, Dixie.
All right, thanks. Talk to you soon.